All right, we're back and we're going to pick up from where we left off. We're going to start talking about the stomach now. We left the esophagus on the last video, if you recall, especially that lower esophageal sphincter that is going to connect with the stomach and could cause regurgitation or reflux. All right, now let's go into the stomach and talk about it. So the stomach size varies according to the amount of distension. So after a meal, of course, the stomach walls are distended, and as the food leaves the walls, they begin to collapse. An adult stomach can usually hold about 1 liter to 1.5 liters of food. Now, if you notice, at some places, like I think like a 7-Eleven or something, they have big gulps or about a liter amount of pop or sodas, right? That's because advertisers, manufacturers, they know how much the stomach can hold, about 1 liter to 1.5 liters. So somebody brilliantly said, well, let's just make the drink 1 liter, because that's how much they can hold, a human can hold, about 1 liter to 1.5 liters, right? The stomach is in the upper left quadrant of the abdominal cavity, and it sits under the liver and the diaphragm. I'll talk about the quadrants a little bit later. I want you to know that the stomach is a dynamic organ. In other words, it's not static. It's always doing something. It's always moving. The position of the stomach alters. So you eat a large meal, then the stomach may be more distended than if you consumed a smaller meal. And sometimes larger meals can actually make breathing difficult, right? All right, let's look at the stomach. We're in chapter 38. We're going to complete chapter 38 on this video and actually go into chapter 39, where your author is calling it the lower gastrointestinal. We're going to go into that where we talk about small intestines, large intestines, and on. So let's just talk about the stomach for right now. So I'm going to draw a little bit of the esophagus here, and then put the stomach here. Okay, we'll just draw a little bit of the stomach, and I'll just draw a tad bit of the lower intestines. That's called the duodenum. Some people pronounce it duodenum, duodenum, duodenum. Either way, it's okay. So here is the stomach. I'm going to put this lower esophageal sphincter here so that you can remember it. LES, very important, that sphincter there. And let's just remind it that this is the esophagus. Okay? So we got the lower esophageal sphincter here, the esophagus there, and now it's connected to the stomach. So that'll give us some reference points. This is the fundus of the stomach, the top part. This is going to be the body. I'm going to put a sphincter here. That is going to be known as the pyloric sphincter. So this area is, I'll take it this way so it won't get so crowded there. This is the pylorus, okay? This little C-shaped here is the duodenum, or as I said, you could call it duodenum area. And then we have, let me put this in a different color. This curve here is a large curve, so that's called greater curvature. And this is a smaller curve. It's not as great, so it's going to be called lesser curvature. Okay? So that is basically the divisions of the stomach: the fundus, the body, the pylorus. Of course, the sphincter here, this circular band of muscle that divides the esophagus from the upper part of the stomach, is known as the lower esophageal sphincter. Sometimes some books will call it the cardiac sphincter. You know, it's either way. And then down here where the pylorus is, the pylorus region of the stomach, there's a sphincter here, very important, and that's called the pyloric sphincter. Just before food gets dumped into the small duodenum or duodenum, the pyloric sphincter will open and close intermittently to allow small portions of chyme, that's food that's been partially digested, into the duodenum, okay? So you remember that sphincter muscle consists of circular fibers that open and relax when relaxed and close when they're contracted. Oh, and some other things in the stomach that I'm just going to mention that helps provide a larger surface area. And these are these little kind of folds in the stomach that may not look exactly like that, but these are called rugae. R-U-G-A-E, rugae. And we're going to see those in bladders and stomach things, and really the stomach is like a bladder, but we're going to see that, and it helps have more, the organ have more of a surface area. So the fundus is this enlarged portion, the body is the central portion of the stomach, and then the pylorus, of course, is the lower portion of the stomach, okay? I hope I remember to talk about the divisions later. I'll try to do that. Now, when we, and I talked about the rugae, these are folds of epithelium in the lining of the stomach. All right. So now, the gastric glands with three secretory cells, So let's look at gastric glands of the stomach. So these are going to be gastric glands, okay, with three secretory cells, I think if you watched the previous lectures, you will remember that C with a little line over it means with. So gastric glands with three secretory cells, okay? This marker. Let's get a different one. So we have chief cells. Chief cells are these zymogenic cells. You can kind of see the word enzyme in there. So when you think about chief cells, think about that they secrete enzymes. And they secrete enzymes in the gastric juice. And the gastric juice is just all the stuff that goes on in the stomach. When we talk about gastric, we're really just talking about the stomach part. So these gastric juices, all the stuff that's in here, bile and acids and water and hydrochloric acid, we mentioned that acid, and just a lot of things are in there, enzymes and stuff. That's the gastric juice. So here are some other chief cells are responsible for the enzymatic portion of the gastric juice. Parietal cells. Now these cells are pretty important because they secrete the hydrochloric acid. The HCl, right? That's really the acid that really gets the food kind of broken down to make it easier for enzymes to help digest it. Another thing about the parietal cells, they also secrete something called intrinsic factor. So I'll abbreviate that as IF. It looks like if, but it's going to be short for intrinsic factor. And I'll come back to intrinsic factor in a minute, so I want to get all three of these glands up. And then we have endocrine cells. Endocrine cells that are important in secreting ghrelin. And what does ghrelin do? It increases the appetite. Now they've been trying to synthetically make this this hormone, I guess you call it hormone because it is being released from the endocrine system, so endocrine systems release hormones. So this ghrelin increases your appetite. Oftentimes when people undergo chemotherapy or other types of, receive other types of medication or even surgeries, they may lose their appetite. Patients may lose their appetite. So if we could somehow stimulate their appetite by synthetically inducing ghrelin to increase the appetite, that would help the person eat and maybe gain more strength, right? So let me go back to, so we know the chief cells is going to secrete enzymes with these zymogenic cells. We know the parietal cells secrete the hydrochloric acid, and this funny thing called IF, or intrinsic factor, don't call it IF, I'm just abbreviating the intrinsic factor, and then the endocrine cells are going to secrete this hormone ghrelin to increase the appetite. I want to go back for a minute and talk about intrinsic factor, okay? Intrinsic factor being released from the parietal cells. Let's remember that. So, intrinsic factor is what is needed to bind vitamin B12. And vitamin B12 is only seen, or you can only get it through animal products. So that could be eggs, cheese, yogurt, milk, of course meat, anything that comes from an animal. You get vitamin B12, all right? So vitamin B12 needs to be hooked up. When you consume vitamin B12, it must be combined with intrinsic factor in order to be absorbed into the body to benefit the body, and especially the brain. So B12 is important for human brain. So vitamin B12 can only be absorbed in the small intestines, in the terminal ileum, if it is bound to intrinsic factor. So here we have, let's see, I'm going to take this rugae out and some of these other lines so that we can consume. So let's say the parietal cells, of course, they're doing their job. So it's intrinsic factor in the gut, in the GI system. Intrinsic factor. We'll just, just so you'll know, that's coming from the parietal cells. Of course, they secrete hydrochloric acid too, but right now we're going to talk about intrinsic factor. Now you've just had a big old turkey burger, and you're eating it, and that came from that turkey burger came from a turkey, so it's an animal. So it has vitamin B12 in it. So now you got vitamin B12. Now you consume vitamin B12, and it's coming on down. Now it has to bind to intrinsic factor. It has to bind to intrinsic factor. That is the only way, is for that intrinsic factor to be there. When you eat the animal product and get the B12 from it, in order to absorb it and benefit from consuming the vitamin B12 from the animal product, it must be bound to intrinsic factor. It will then go down to a lower part of the intestines, known as the small intestines. the very last part, the terminal ileum, and then it is absorbed. Vitamin B12 is then absorbed into the blood and into the body at that point, and it benefits the cells, especially the brain. The thing is, if we don't have intrinsic factor, like in some cases where you have a lot of people are getting surgeries and having their stomach reduced, and some of the stomachs are big as a walnut, something like that, that's not going to be enough intrinsic factor. Of course, also you're not eating enough animal product anyway for, if you got a stomach that big, for anything to attach. But you can become vitamin B deficient if you are strict vegan, meaning no yogurt, no cheese, no eggs, no animal products whatsoever. No fish, anything like that. You are not going to get the benefits of vitamin B12. So you will have to supplement your diet with vitamin B12. They have some sublingual tablets you can take, and they'll just dissolve under the tongue. You can go get shots, injections of vitamin B12, etc. So that is it on the importance of vitamin B12. If when you don't have it, it affects the brain, and you may end up with ataxia, meaning you walk kind of oddly, your thinking won't be right, your system and neurologically will not function optimally if you are lacking vitamin B12. So having vitamin B12 and of course intrinsic factor that's released from the parietal cells is a very important combination. So let's look at the gastric muscles. Let's go into the gastric muscles now. We know that there are 3 layers of gastric muscle: longitudinal muscle, circular muscle, and oblique. We could just put it here. Gastric muscle. We have circular muscle. Longitudinal muscle, and oblique muscle. All of this muscle is, and the arrangement of these muscles allow for strong contraction and efficient mixing. All of that's going to go on in this stomach. So circular muscles, longitudinal muscles, and oblique muscles will allow for efficient mixing and churning of foodstuffs in the stomach and allow for contraction to get the food stuff or the chyme out of the stomach, right? Functions of the stomach. What is the functions of the stomach? You know I'm pretty big on asking about function. So please pay attention to the functions of the stomach. Here are functions of the stomach. Let's just put them up here. Functions of the stomach. Well, we just mentioned, pretty big ones that you could guess that the stomach serves as a reservoir, correct? So the stomach is like a pouch, in other words, bladder, whatever you want to call it. It's a reservoir that stores food. So that's a good reason to have a stomach. It stores food, right? It secretes gastric juice, and that helps with digestion. And we talked about gastric juice already. A lot of stuff is in that. Enzymes, acids, alkaline material, but mainly acids. Enzymes, etc. That helps with digestion. It secretes gastric juice, and that helps with digestion. It churns and mixes food. We talked about that when we talked about the muscle here. So it churns and mixes food. The stomach secretes intrinsic factor. What is the importance of intrinsic factor? Well, intrinsic factor has to be available in order to combine with vitamin B12. They both go down to the terminal ileum in the small intestines where the vitamin B12 is absorbed, and it helps with us neurologically, okay? That's the big picture on that. Most of our absorption is in the small intestines. The stomach, not so much involved with absorption. Some, but if we're really going to talk about absorption, we have to look at the small intestines. And particularly for the intrinsic factor and vitamin B12, it has to be in the terminal ileum, so the last part of the ileum. So with that mentioned, I want you to know that the stomach has limited absorption. It's really not its job to absorb. It's really its job is to mix and churn and get everything all mushy so it can be easily absorbed. So absorption is mostly reserved for the small intestine. We know too that it produces hormones. So we just learned that. Hormones. We said it was ghrelin, and I will put gastrin here too, because that will help get the hydrochloric acid going. So gastrin and ghrelin, right? And then another thing about the stomach, interestingly enough, there's protection against pathogenic bacteria in the stomach. So we'll say protection against pathogens. Mainly bacteria, but that's good. We'll leave it at that. So those are some functions of the stomach. You can always consult your text to look up more if you think you deem it necessary. Always feel free to fortify your notes because I can't discuss every detail in the text. That's why you have one. And I'm just hitting big picture things, big items, so that you can understand and interpret the text a little bit better. All right? So let's go on from the stomach and move on to the small intestines. And then we'll try to finish up, get all the way to the appendix before the end of this lecture. So let's erase the board. And let's move on into the small intestines. Okay? Now, what did we say about the small intestines? We just said that that is the main area of absorption, correct? Yes. Good. All right. The small intestines is really deemed small intestine because of the diameter of the intestines. Right? All right. So it is about 1 inch in diameter. That's the size of the small intestine. But it's very long. It's about 20 feet long. It's called small just because it's just about 1 inch. But it's very long. It's got 3 divisions. Okay? The first segment is the duodenum, or duodenum. I'm not going to keep saying that, but I do want you to know you can pronounce it either way. Other people will try to correct you, but you can pronounce it either way. This is in the uppermost division. Or we'll say, yeah, uppermost division. And this is actually the first segment. So I'll just say that too. This is the first segment of the small intestines, right? And it attaches to the stomach and is shaped like a C. Very short segment. Let's see. Shaped like a C. I think it's about, let's just say it's about 10 inches. It's a little bit less than a foot long. It's very short. And that makes me think of a point I need to make. And I'll do that. Jejunum. This is the second segment of the small intestine. And it is about 8 feet. So it's kind of long. That's the jejunum. And then here's the ileum. This is the third segment. And it continues, this is long too. It continues, this is the longest, winding for about 12 feet. So we can see that 8 plus that 12 gives us, and I know we got that 10 inches, but this gives us about 20 feet of small intestines. And I know it says small intestines, but remember, it's long, but it's small based off its diameter, right? Now, the thing that I said I was going to go back to is this, the duodenum. Okay, let me just put it here. Draw a little bit of the esophagus, put the stomach here, and then the duodenum, and then you could just imagine that all the rest of that is the jejunum and the ileum. Here, this C-shaped duodenum here, and then that pyloric sphincter that we learned about before being here. I wanted you to realize that this pyloric sphincter opens and closes intermittently about every 10 to 15 seconds to allow all the contents from the stomach to slowly go into this small duodenum. Now remember, how much can the stomach hold? Correct. 1 to 1.5 liters of contents. We would not want all that content rushing into the duodenum all at one time. You see the duodenum is very short. It's less than a foot. So if all that just rushed in, it would just be overwhelming, right? So the pyloric sphincter is there to regulate how much and how often the contents are released to give this, so you don't overwhelm the duodenum. I know you have duodenum, it'll go into the jejunum and then the ileum, but we don't want to overwhelm this small section, this 10 inches of the duodenum of the first part of the small intestines. So the pyloric sphincter's job is to regulate the contents and let an easy flow, opening and closing about every 10 to 15 seconds to regulate the flow of these contents into the duodenum so it doesn't overwhelm it. That was one thing, a point I wanted to make that I would have forgot. All right, so that's that. Let's talk about the wall of the small intestines. The wall of the small intestine. Please note, and you'll probably see this word in your lab book when you get on the digestion part of the lab book, you will see plicae circularis. This is a lining that has circular plicae. These are folds. It's a little French word that means folds, circular folds in the lining. They have these tiny projections in these folds of the small intestines that are called villi. So I'll write this word circular plicae so that when you do see it again, in your lab book or in your text, you'll recall what we said here. That they are folds. Folds in the linings of the small intestines. Associated with this are the villi. Here's the villi. And I want you to make sure that you look in your text to see these villi. Okay? They're about 1 millimeter tall. About 1 millimeter in height. These are villi. One of them would be a villus, but this more than one, okay? So what are villi? These are modified muscular layer. This is a modified muscular layer. It's millions of these projections, like a bajillion of them, well, millions. And they give the intestines, if you were to open the small intestines and lay it out, it gives it a nice velvety appearance. So these little, they're finger-like projections, right? Don't they look like finger-like projections called villi? If you were to open up the small intestines, lay it out, it would be nice and velvety looking. The importance of this is that they actually extend the surface area. Because where does absorption take place? Mostly take place in the small intestines. So you want to have a large surface area so that the absorption from the vitamins and minerals of the foodstuffs that you eat is absorbed into the body. Interestingly enough, each villus, and I'll make these the colors that they make, each one of these villi contains an arteriole, a venuole, and a lymphatic vessel called a lacteal. On the surface of each villus, there's another type of epithelium. It makes a brush border, and it's known as a microvilli. So let's first look at, in each villus, and I'm telling you, it's a bajillion of them. Each one has in it a venuole. So say we're going to put a venuole in each one. Each one has a blood supply of a venuole, an arteriole. Let's see if I can put all three of these things in here. Kind of narrow. And then it has a lymphatic system as well. Lymph tissue known as a lacteal. So I'm just going to try to squeeze in the little lacteals in here so that you can know that they're in there. Three things: a blood supply, venuole, arterial, and lacteal. The other interesting thing about these villi is that they have even more airways to increase the surface area. And that's these little things on them, like this, called microvilli. Now with these, you can't really see them. You need a microscope for these. But I want you to know the microvilli also, they look like a brush, right? Would you say they look like a brush? Then that forms a brush border. So you got the villi, the finger-like projections, but on top of those are these microvilli that form a brush border. And yes, they do look like a brush. All right? Villi and microvilli in the small intestines increases the surface area 100-fold, because this is the main site of digestion and absorption. So it's very important that we have these. Okay? Really, only monosaccharides, when it comes to the carbohydrates, only monosaccharides, glucose, galactose, and fructose, are absorbed here. So we can only absorb monosaccharides, cannot absorb polysaccharides, cannot absorb disaccharides, only monosaccharides, so one sugar saccharide. Also, I want you to remember that in conjunction with these villi is a lot of goblet cells. And you remember what goblet cells are. They produce mucus, secrete mucus, right? And they're in the crypts and deep parts of these villi. All right? Good. So that is like the whole picture for small intestines. Let's go on to the large intestines. Let's look at it. So small intestines is 1 inch. Let's see how big the large intestines is, the diameter of it. Okay, so we finished up with the small intestine. Let's look at the large intestine now. Now remember, the small intestine was small because the diameter is smaller. The large intestine has a much larger diameter. It's noticeably larger than the small intestine. The diameter is about 2.5 inches. That's much larger than the small intestines. Small intestines was only 1 inch. This is 2.5 inches. And it's much shorter than the small intestine. If you recall, the small intestines was 20 feet. This is only going to be 6 feet. And 6 feet long. Right? Fortunately, the diameter of 2.5 inches narrows as it gets towards the anus, because if it didn't, you'd have a really huge stool, right? 2.5 inch stool, that'd be pretty big. So it gets narrower as the large intestine gets narrower as it goes towards the anus. So the large intestine is noticeably larger than the small intestine, but it's much shorter. It's 6 feet as compared to the 20 feet for the small intestine. The diameter is much larger, it's 2.5 inches, but the diameter decreases towards the anus, right? Here are some divisions of the large intestines. First, let me introduce the cecum. This is the first 3 inches of the large intestine. And it's in the lower right quadrant. I have to remember to talk to you about quadrants before we get off of this subject, and I'll remember to do that. Let's see, so the cecum is the first 3 inches off the large intestines, then we start going into the large intestine. The cecum is where a connection from the ileum, which is the last part of the small intestines, hooks up to this cecum through ileocecal valve. So ileo for ileum, ceco for cecum, and there's a valve so that the now processed foodstuffs, or the chyme, can now, that is becoming stool now, can enter through this ileocecal valve, a connection from the small intestines to the large intestines, and now go into the large intestine, the colon, to be ready for evacuation. So here's the colon, divided up into 4 portions. So whenever you talk about the colon, please know that you are in the large intestine, okay? So we have the ascending colon, right? This is in a vertical position on the right side of the abdomen. So it's on this side in a vertical position. And the cecum here joins, the ileum here, joins the cecum and the ascending colon. So I mentioned the ileocecal valve that allows material to pass from the ileum into the large intestines. And it's usually, of course, in one direction. You want to make sure everything goes in one direction because you're trying to evacuate or poop out the waste. The next part of the colon is the transverse colon. This is just like the name. It goes transverse. It goes across the body. So it's horizontal. The transverse colon is horizontal across the abdomen. It sits below the liver and the stomach and the spleen, but just above the small intestine. Two things I want you to remember in association with the transverse colon. It has a hepatic flexure, and that means, you know what hepatic means. It means liver, and we're going to be talking about the liver in the next video, and the spleen in the next video. But right now, the hepatic flexure is a bend near the liver. So the liver is on the right side, so that bend will be a hepatic flexure. And then the spleen is on the left side, so the bend of the transverse colon on the left is called a splenic flexure. So there are about these 90-degree bends that from the ascending colon and the transverse colon, and now we'll get to the descending colon, that allows the stool to get ready to go towards the anus. The next thing I think we have is the descending colon. This descending colon lies vertically, but now we're on the left side of the body. It's below the stomach and the spleen, all the way to the iliac crest. The fourth part is the sigmoid colon. And sigmoid means this S shape. It's going to be an S shape. And it goes below the iliac crest now. And you got a sigmoid or S shape part of the colon. And it joins the lower part of, joining the lower part of the rectum. Joining the rectum. This is my little joke. Last but, as in B-U-T-T, not least, that's a joke, the rectum. The rectum is about 8 inches. And that will complete the intestinal tube. We have an anal canal, so this is the colon. And then let's put rectum. That's about, we say, last 8 inches, right? And then we have the anal canal, or anal columns. The anal canal really is like the last inch of the rectum. Canal. Oops. This is the last inch of the rectum. Uh-oh. Don't fall. Okay. And in this anal canal, the last inch, it contains some anal columns that have an artery and a vein in them. And so each column has an artery and a vein. And sometimes these veins can become enlarged, and we call those hemorrhoids. And sometimes they can just be enlarged within the rectum, and sometimes they could come out and be just these, and sometimes they bleed. And oftentimes we'll see these with women who after childbirth, they've pushed and pushed so much trying to get the baby out of the canal that they've also pushed so much that they've strained the blood supply to the rectum, and you'll have these hemorrhoids. We see hemorrhoids a lot in young men too, or in men. That's becoming more and more common, as well as, of course, older people, because they seem to, the elderly seem not to drink enough water, have enough fluids. So when they get ready to go to the restroom, they strain and push, and these veins get inflamed and sometimes in the anus, but you can reduce them. You can gently push them back into the anus and make it more comfortable for the patient. The last part of this will be the, they call it the viviform appendix, but nobody calls that. We just call it the appendix, or veriform, vermiform. Spell this right. Vermiform appendix. Okay. And this is a little 4 inches, approximately 4 inches in length. Okay. Verma means worm or vermis. This is Latin, so this is worm-like, and then form means shape. So it's kind of shaped like a little wiggly 4-inch worm. The function of the appendix is in dispute. Nobody really knows what we have on it for. A lot of theories out there, or I should say a lot of hypotheses are out there, but nothing really proven. So I want you to know that the lumen, and that's the opening of the appendix, communicates with the cecum about an inch below the ileocecal valve, making it an accessory organ of the digestive system, right? So that is what the appendix is. I want to erase this and then show you where, when I was talking about quadrants, what that means, and also just give an overall view of the colon and these things that I've written up here. So let's just take a quick look at this, and we will see what this is. I'll just erase this part, so just give me enough space to draw. So first of all, we had the cecum, if you recall that, and we just talked about what hangs off of the cecum, and that's a little bit of an appendix, correct? So that's the cecum. And then we'll just draw the rest of this. Make this an S shape. And I'll just make that the anus. Is that an S? Yeah. So this is the appendix. And I guess here, I'll just make this the small intestines so that you can see here, this entrance will be the ileocecal valve here. Let me just, so the cecum has a couple of things hanging out. The ileum going into here from the small intestines, and then the appendix is also hanging off of here. This is on the right side, so this is the ascending colon. Going across the body this way would be transverse colon. Going down this way will be the descending colon. Then of course that S shape is your sigmoid colon. And then on here will just be the rectum, and then that little bit there will be the anus. Now the anus, kind of, if you've never seen one, it looks like it looks just like lips that are, that's the way an anus looks. Well, maybe not with lipstick on it, but you know. I want to bring your attention here to this flexure here. Hope you can see that. And this little bend here, that flexure. So this is on the right side. The ascending colon comes up, over, down, then you poop. This flexure here on the right side would be the hepatic for the liver, hepatic flexure, which means a bend. Right? This one on this side on the left would be where the spleen is. So that's a splenic, and that's one E flexure. So the hepatic flexure is on the right. Let me make sure that you know what side of the body we're on. This is the right side of the body. Always orient yourself, and this is on the left. So on the right side you have the liver, so that's the hepatic flexure, this bend here from connecting with the ascending colon and the transverse colon. And then on the left side, you have the transverse colon hooking up with the descending colon. Please note that the foodstuffs is going in this direction. Going around through here, and then I'm hoping into the toilet. That makes sense to everybody? Just to give you an idea. And of course, in all this here is the small intestines here. All very neatly packaged and very easy to understand. The other thing I said I was going to do before we conclude this video is I wanted to go over the quadrants. Yeah. All right, let's look at this. So when we look at the belly or the abdomen, let's just say this is the abdomen. And just gonna kind of break it up into quadrants or fours. And that's the umbilicus here, the belly button. Again, always orient yourself. Know that this is the right and this is the left anatomical position, correct? In this quadrant, when we palpate up here, or we're touching you up here, and you say, oh, I have pain in my, up here. A lot of people just call this whole area, the entire abdomen, they just say, oh, I got pain in my stomach. No, that whole area is not your stomach. Your stomach is in a specific area. And this is how we can differentiate what is going on in the abdomen. Now, I know that there is such a thing as referred pain, so you can make some mistakes, but for the most part, if somebody's touching over here to the right, I know that that's not a stomach ache, because over here is the largest organ in your body, and that's the liver. So we palpate here, touch here, feel here. You got liver, and this little thing that hangs off of it is the gallbladder. In our society, a lot of people get gallstones. So that could be a thing. But if you're ever trying to pass a gallstone, you will double over in pain. It's like something you've never felt before. This is what I've been told. A lot of people that have pregnancies get gallstones. People that lose a lot of weight really quickly, they get gallstones. Gallstones are also prevalent in certain populations like native indigenous people to this country. They get a lot of gallstones. So it is interesting just to see who gets gallstones. And of course, people that eat a high fatty McDonald's all fast food diet will get gallstones. No doubt about that. The other thing down here in this lower quadrant here, if you say, oh, I got pain here, usually that would be the appendix. But since women also have ovaries kind of low, even though they're a little lower, like down here, it can be referred pain. So I'll just say it can be ovaries too. Like you can have cysts or something on the ovary. So just remember that in the females. A lot of appendicitis or appendix pain will also radiate to the umbilicus. And if we touch the belly around in that general area where the belly button is and push it and then pull a hand off, and you scream or you cry, that's rebound pain. And usually that means somebody's going to start opening up your stomach. Some surgeon is going to open up your abdomen and take a look, not stomach, open up your abdomen and take a look. Because that just indicates that something really inflammatory is going on. Here on the left thing you have here would be the stomach that we learned about earlier. Not much else going on over here in the stomach. Got a little spleen here more to the flank. Of course your kidneys are way in the back, retroperitoneal, but that's about it. And here, down in this general area on the left where you're getting ready to poop, a lot of times people just get constipated. So that can be constipation if you have pain there. But another thing too, when you don't eat a nice high fiber diet and or you don't get enough fluids, specifically water, you can get something called diverticulitis and diverticulosis, usually seen in older populations, but it can happen to anybody. I'll just put diverticulosis and diverticulitis. That's an inflammation of these diverticulars, which are usually, like in this general area, outpouchings like that. And then you gotta watch your diet if you get diagnosed with these, because little seeds and kernels can get caught in here and really set up a big inflammation. So you can't eat like popcorn. Your diet is gonna be kind of limited. No seeds and I guess some nuts, I don't know, but definitely no like popcorn and stuff like that, because then it can get into these little diverticular, these outpouchings and cause inflammation. So anyway, when we palpate your belly or your abdomen, these are things we're touching, feeling to see and make a determination of your illness, like how serious it may be. If it's down in this area, around here, that's really serious because that could be an appendicitis, right? You don't want your appendix to burst. It's hanging off here. Sometimes it can get just filled with bacteria and fecal matter, have a fecal lift, and that'll just make you have sepsis. And over here, gallbladder, usually it's stones, but sometimes they just have you pass the stone, which is painful, and tell you to stop drinking all that pop and just drink water. So that's something I advise anyway. So that about does it for, at least for this portion of the lecture. And when we pick it back up, we will talk about these things that I've mentioned here, liver, the gallbladder, other things that are in the abdomen, the pancreas, the spleen over here, and we'll just talk about those things in the next video. So I'll see you then.